Hello, Professor Meek. My name is Vera Clark, and I'm going to be talking to you today about compartment syndrome. So, what exactly is compartment syndrome? Compartment syndrome occurs when there is neurovascular compromise, which leads to a disruption in perfusion to the body tissues. This happens when pressure occurs in a small space of the body and intense pressure builds up in that space. Blood flow is decreased, which leads to low oxygen to that area and severe pain. When perfusion is interrupted to that area for a prolonged period of time, it can lead to tissue damage and cell death. This typically occurs with patients who have a cast on their extremities or a splint, elastic bandage wraps, or open reduction with internal fixation or external fixation. This is an emergency situation. It can potentially lead to amputation, so it's critical that the nurse identifies the signs and symptoms of this condition and notifies the healthcare professional immediately. So let's talk about the signs and symptoms of acute compartment syndrome. Patient will complain of pain. This pain will be severe with passive motion where typically there shouldn't be that much pain even after a surgical procedure. Analgesics that worked previously tend to not work as well. The patient's going to report inability to feel with numbness and tingling in the area. They're going to have decreased sensory perception. They're going to, the nurse is going to see swelling. There could potentially be coolness of the skin, mottling, skin discoloration. The skin will present pale and cool, and that is due to decreased perfusion. Also, decreased pulse or even pulselessness can occur. In terms of diagnostics, labs aren't typically used to diagnose this condition. This is a condition that is typically assessed and diagnosed with the presentation of external signs and symptoms. Treatments for this condition usually entail monitoring of the pressure with a device that monitors the pressure and puts out digital information on a display for patients who are unresponsive or even comatose. Possibly, if the situation is severe enough, there could be a fasciotomy where a surgery is undergone and the fascia is removed completely, or sometimes an incision to the fascia will be completed in order to reduce the pressure and restore perfusion to the area. As a nurse, nursing interventions are very critical for a patient who has just received a cast or any type of splinting, anything like that of an extremity. The nurse needs to monitor the site closely for signs of decreased circulation to the limb. Again, that's going to be swelling, coolness, mottling, and discoloration, and the patient complaining of severe pain. The nurse is going to perform the 6 Ps, which is assessing pain, pressure, paralysis, paresthesia, pallor, and pulselessness. The nurse will assess the capillary refill of the extremity, but should be aware that in adult older patients, like the elderly, arterial insufficiency typically is occurring, so the decreased capillary refill time might not necessarily be a good indicator of this condition for that population. If the nurse suspects that there is any type of acute compartment syndrome occurring, they must notify the healthcare professional immediately. If a fasciotomy or incision is conducted, then infection control techniques will need to be implemented, monitoring the wound for any signs of infection, monitoring the patient's temperature, making sure that the wound is cleaned regularly, dressings are changed, and other infection control interventions are going to need to be implemented. So that is my discussion today about compartment syndrome. Thank you.